All right, let's move into magnesium, another one of the supplements you recommended. Let's talk about there are so many different types of magnesium in supplement form. What type do you recommend? How much? And there's a lot of people, including myself, that like to take it before bed for its supposed help with sleep. I mean, that's very subjective. I can't say I've noticed a specific difference with sleep when I've done that, but let's talk everything magnesium and how you feel about that as a supplement.
Well, in an ideal world, Jesse and his family would get up in the morning, go to the river or stream, and drink water. But we can't, right? It's got sewage, farm runoff, all kinds of other garbage in there. So you can't just drink that water. So you have to filter it. Either your city filters it, or maybe you filter, or maybe both. And water filtration, you'll see it's an A water filtration system. They're extremely good at removing all magnesium. Uh, the family gets up in the morning and you go hunt for wild plants that you know are safe. And wild plants are rich in magnesium. Cultivated, farm sourced produce is very low in magnesium, typically 80 to 90% less magnesium than wild plants. And so most of us don't anymore remember what plants are safe to eat, nor do you want to go out in the cold and dig for roots and gather plants. So no one really does. Very few people do that. So we rely on magnesium supplementation to compensate for the deficiencies of water and plants, produce. Now, the form of magnesium, I think, is a bit overblown. It does have an effect, and you can put this to use. For instance, magnesium citrate is better as a laxative. If you have some constipation issue, regularity issues, magnesium citrate is a good one. But there are multiple good forms: magnesium chelate, magnesium malate, magnesium um, uh, um, chloride. There's many good forms. The key is to look at the quantity of magnesium, not the total weight. So if it's magnesium malate, the tablet may weigh like 1,200 milligrams, but you just want I think it's 130 milligrams, something like that, of magnesium. So you want the so-called elemental magnesium. And you want on the order of about 400, 500 milligrams. One of the advantages of all the things you and I have been talking about is so we get rid of grains, we thereby rid ourselves of phytates that bind magnesium, and you poop it out. So no wheat, no grains, you don't bind magnesium anymore. Eating better food, like organic food, a little bit higher in magnesium. And so there's some advantages in what we're doing that amplify the benefits of magnesium and your retention of magnesium. Because it's the most important thing you can do for bone health. Magnesium is a major constituent of your bones. It's also a major player in heart rhythms and blood pressure. In my cardiology days, we'd have people on diuretics. People would be taking chlorthalidone or hydrochlorothiazide or Lasix, furosemide, or others. And those diuretics cause massive loss of magnesium and potassium too. And people would come in cardiac arrest, literally, or they'd be in the hospital for some other reason and they'd have a cardiac arrest. They'd have a very unstable heart rhythm. It's called torsade de pointes. Or ventricular tachycardia. These are very dangerous heart rhythms that are fatal, often fatal. Well, if somebody has that, you, as quickly as possible, give them intravenous magnesium, in this case, magnesium sulfate. You can give megadose because there's no diarrhea. Oral magnesium gives you diarrhea, but you can give megadose intravenous because it doesn't go through the gastrointestinal tract. And you turn off those rhythms like that. Think about that. So magnesium, a lack of magnesium can be life-threatening. How about pregnant ladies? If a woman has preeclampsia or eclampsia and is at risk for seizures and losing the baby and dying, what's the first treatment? Intravenous magnesium. How about a person with really bad migraine headaches? So bad they go to the ER for painkiller medication and other meds. What's one of the first things they do? Intravenous magnesium. So what the healthcare system is good at doing is giving you acute urgent care. They suck at the long-term healthy practice. What they should have done in all those situations is say, okay, we'll take care of the acute deficiency now, but you need to be aware that you should take magnesium in some form, magnesium malate, chelate, whatever, every day so that this doesn't happen again. But that conversation almost never happens.
And do you find the timing of day really matters with magnesium? Coming back to taking it at night to help with sleep, is that something you do or have found with others that it's helpful?
Some people do. I'd say maybe a third to a half of people will say that same thing you're saying. That is, they take magnesium at night, or if they take it in the daytime, it makes them too sleepy. So it can be useful for, I don't understand why, but it does seem to apply to a lot of people.
If you enjoyed that clip, you're going to want to head over here and catch the full episode. I'll see you over there.
No, there's nothing else that tracks with LDL cholesterol because it's not a real number. It's a fictitious number. It's obtained by something called the Friedewald calculation. The LDL cholesterol reducing franchise, statin drugs, PCSK9 drugs, all that stuff pay huge amounts.